Good afternoon, everyone. My name is Deborah Hodges. Welcome to the Institute of Medicine of Chicago. We're just going to give everyone a moment here in order to get settled in as our attendees are coming on board here. So I thank you for being with us today. Today's session addresses the youth mental health crisis and pathways to care and changing the mental health stigma that is out there. Again, my name is Deborah Hodges. I've been with the IOMC since 2019, and it's a pleasure to be with all of you today. Today's topic is very, very important, and we have three outstanding speakers with us today that are going to share their expertise and their insights. Dr. Tom Allen, Ms. Gloria Barrera, and Dr. Tara Gill. And this issue is very important to IOMC and to many people for many different reasons. The numbers and the social impact are important to take notice, especially. And here are a couple of them that we just want to highlight. 42% of Illinois high school youth reported that they felt sad or hopeless every day for 2 or more weeks in a row during a 12-month period before a survey that was conducted by the CDC Youth Risk Behaviors Survey in 2021. And also in a recent poll conducted in October by Crain's Chicago area parents and school-age children from the ages of 5 through 17 said that the local, state, and federal governments needed to provide more aid to support mental health. 92% of these parents also stated that they felt that school districts ought to provide more mental health services and assistance to them. And unfortunately, in 2020, during a survey that was conducted by the CDC, suicide was the second leading cause of death for young people ages 10 to 14 and 25 to 34, and among the top 9 leading causes of death for people ages 10 to 64. So obviously these data points here are very alarming and concerning and need to be addressed. Additionally, nationally, the number of children ages 3 to 17 were diagnosed with anxiety, and that grew between 2016 and 2020. And those with depression were at 27%. And then, of course, we also know of the highlights that had taken place in regards to when COVID was with us for a period of time. Also, 20.3% of high school students reported in Illinois that they were seriously considering attempting suicide in a 12-month period. So many of these factors are being addressed by experts like our speakers that are with us today, and also many of you who may be attending this webinar as well. So let me just briefly orient you to the webinar, and then we'll turn this over to Dr. Allen and our speakers. So today's agenda, we're going to just bring up 1 or 2 programs that is going to be taking place in the near future. We'll then conduct the presentation itself for about 40 minutes, 45 minutes, and then open it up for questions and answers. And feel free to put comments in the chat box during that time. And then, of course, we'll do a closing at that time. So today's webinar is covering 3 learning objectives. And so by attending this program, we hope that you will improve your knowledge regarding youth mental health access and pathways towards care, be able to discuss health equity and how it impacts youth engagement, especially in mental health services, and increase the awareness of mental health stigma, all of which are very important. And if you're joining us for the very first time and are not familiar with the Institute of Medicine of Chicago, let me share a little bit of information about us. The organization was founded in 1915. It's an independent nonprofit organization of leaders in the health field, and it's an interdisciplinary organization. It draws upon the expertise of diverse membership, regional leaders, other stakeholders, and together they address critical health issues through different approaches in education, research, communication, and trusted information. It's a 501c3 organization and has a long history of providing initiatives in the Chicago state and the state area as a whole. A few of them that you may not be familiar with is that IOMC was involved in creating, with others, the first public ambulance service in the city of Chicago, and then also expanding it more prominently in the west and south sides of Chicago itself. They were also fostered collaboration in hiring Black physicians in Chicago hospitals. They advocated for a medical examiner office instead of a coroner only. They've been promoting fair housing and care for the homeless and the unsheltered as far back as 1930. And they established an African American Health Commission to improve the access to care in many neighborhoods. Today, IOMC is involved in maternal and child health, social determinants of health, led pathways in children and communities, continued care in the homeless and unsheltered, behavioral health, and more. And that leads us to today's specific program on youth mental health. I want to just bring up two aspects before we start our program today. IOMC will be holding their annual fundraising and annual meeting in June, on June 20th. And it will be held at Mangiano's Restaurant. And all are welcome, whether you're a fellow member. So please consider attending. At that particular event, the IOMC 2020 Healthcare Awards will also be presented. There are 7 award opportunities for you to nominate yourself, your colleagues, your organization, and others. So feel free to go to the website to check that out. All nominations are due by May 1st. And again, that event is on June 20th, 2024. So mark your calendars for that. We hope that you can join us. So at this time, what I'd like to do is to introduce Dr. Allen, who will lead this presentation itself. Dr. Allen is with IOMC. He's on the board of directors. He's the executive medical director of behavioral health and government programs at the Health Service Corporation in a large area, including Illinois, Montana, New Mexico, Oklahoma, and Texas. And he's the chief psychiatrist for Blue Cross Blue Shield Medicare program. And he's also the membership chair and program committee, a member of the program committee. So as you can see, he's very busy. He's also going to be leading the behavioral health work group. So if you're interested in being on that work group, please feel free to contact our office and we'll connect you with Dr. Allen in order to determine, if it's a good fit for you. So Dr. Allen is, after graduating college at the University of Wisconsin-Madison, he completed medical school along with his residency in psychiatry and fellowship in hospice and palliative medicine at Northwestern University, Feinberg School of Medicine in Chicago. He worked approximately 10 years as a psychiatrist in community mental health and private practice before transitioning to managed care. He's board certified in both psychiatry and hospice and palliative care. So we're very pleased to be able to have him on the board and with us today to leading this presentation. So at this time, I'm going to ask Dr. Allen to take over the presentation and our speakers. So Dr. Allen, welcome.
Thank you, Deborah. Good morning, everybody, or good afternoon. Today, I have the honor of introducing our next speakers. They are highly accomplished professionals who will share their insights and experience and recommend actions to advance wellness during this youth mental health crisis. Our first speaker is Gloria Barrera, who works as a certified school nurse at a public high school outside of Chicago, and she is a visiting clinical associate professor of nursing at UIC. She has her master's degree in nursing and is a past president of the Illinois Association of School Nurses. She is committed to improving child health outcomes among our most vulnerable populations through her current practice, advocacy, and teaching. Ms. Barrera was elected as the first Latina president of the Illinois Association of School Nurses in 2020 and served during the COVID-19 pandemic. She's been engaged with ANA Illinois by serving as an expert panel member of the Diversity, Equity, Inclusion Committee, and she now serves as elected representative to the ANA Membership Assembly for 2023. She was appointed to the IDPH Diversity in Healthcare Professions Task Force, as well as the Governor's Illinois Terrorism Task Force School Safety Committee. She is a vital member of the American Public Health Association's Nursing Section and Nursing Coalition on Climate Change and Health. And she is a fellow of the Alliance of Nurses for Healthy Environments. Most recently, she was named 40 Under 40 in Public Health by the de Beaumont Foundation. Welcome, Gloria. And next, our next speaker is Dr. Tara Gill. who is a licensed clinical psychologist with the Center for Childhood Resilience in the Pritzker Department of Psychiatry and Behavioral Health at the Ann and Robert H. Lurie Children's Hospital of Chicago. And she is an assistant professor at the Feinberg School of Medicine of Northwestern University. Dr. Gill has been with the Center for Childhood Resilience at Lurie Children's Hospital for the past 9 years. She has approximately 20 years of experience in outpatient community, hospital, and school-based mental health. That includes work at the Mount Sinai Hospital's Department of Child and Adolescent Behavioral Health and the DePaul Community Mental Health Center. Her work focuses on increasing best practices and capacity building with educators, community leaders, and other mental health professionals. She is particularly interested in working with children from racialized communities and trauma saturated backgrounds, and her career is focused on advocacy, child welfare, policy, and community engagement. Dr. Gill is committed to increasing equity and addressing racism in education and healthcare. In collaboration with the Chicago Department of Public Health and the Health and Medicine Policy and Research Group, Dr. Gill is the co-chair of a task force that is working to elevate trauma-informed and healing-centered frameworks in the city of Chicago. Welcome, Dr. Gill. So at this time, I would like to turn over the presentation to Gloria, who will begin our discussion today.
Thank you. Thank you, Dr. Allen, for kicking us off. Really a big thank you to IOMC for including the valuable and powerful voice of school nurses in this important conversation. There are dozens of studies documenting what many are now referring to as the children's mental health crisis, as we already heard from Deborah in the introduction. And that's including one from the US Surgeon General that shows that over the past 10 years, high school students who reported feelings of sadness or hopelessness increased by 40%. Another alarming statistic is from the CDC, which reported that between 2019 and 2021, emergency department visits for suspected suicide attempts dramatically increased, and particularly for adolescent girls. These data points, in addition to the many others that we heard at the introduction, led 3 leading professional organizations in child health to come together to declare a national emergency in child and adolescent mental health. We know that youth who have mental health problems are more likely to experience violence, engage in risky behavior, and struggle in school. Mental health challenges for students K through 12 have increased significantly in the past several years, not to mention with the impact of the pandemic. When students have support to meet their physical, emotional, and academic needs, they are able to fully engage in their learning. So the mental health needs of adolescents are often first identified in schools. Therefore, it is critical that schools be equipped to provide a safe environment with mental health supports. Schools are increasingly looked at as an institution that can play a critical role in helping children acquire the knowledge and skills necessary to make healthy choices and improve the health status of our nation's youth. So what does that support look like exactly? When we talk about schools playing a vital role in preventing mental health problems among youth, as well as in identifying and supporting youth who have mental health problems, we're talking about school-based behavioral healthcare teams. The providers on the team include social workers, psychologists, counselors, and school nurses as specialized instructional support personnel that lead the way in helping schools fulfill this role. Next slide. It is the position of the National Association of School Nurses, NASM, that student behavioral health and wellness be prioritized for students to successfully access and engage in educational opportunities. Behavioral health is defined by the promotion of mental health, resilience, and well-being, treatment of disorders, and support of individuals and families who experience these disorders. School nurses are frontline healthcare professionals and frequently are the first school staff to identify students with symptoms of stress, anxiety, depression, and other behavioral health challenges. In the wake of the COVID-19 pandemic, it has become even clearer that schools need additional structures and supports to identify, triage, and address student needs. The federal government, along with a number of state governments, have recognized this need and enacted legislation to support student mental health. For example, in the 2022 fiscal year, the Federal Student Support and Academic Enrichment Grant Program provided $1.28 billion, an increase of $60 million to school districts. This funding focuses in part on facilitating a safe and healthy school environment and can be used both for hiring and for providing professional development to school counselors, for example. However, while schools already provide mental health support to students, the demand for support services appears to be outpacing the available resources and capacity of providers. School nurses, who are sometimes overlooked in the broader conversation about student mental health, are already integrated into the fabric of the school community and provide multifaceted support to students, their families, and the communities that we serve. Leveraging school nurses' expertise and connections to students as an existing resource is one way to boost capacity for mental health supports in schools. School nurses work in collaboration with other school healthcare professionals and community providers to support upstream approaches to improve the mental well-being of all of our students. So it's no secret that a student is more likely to raise their hand in class and ask to see the nurse, rather than raising their hand and say they need to speak to a social worker. Mental health concerns can manifest in physical ways. We school nurses know that. For example, frequent visits to our office for stomach aches, nausea, or dizziness. These kind of touch points allow school nurses to build connections with students and advocate for their care. In addition to caring for students' physical health needs, school nurses can provide counseling and educate students on self-care and coping skills. Next slide. According to the CDC, mental disorders among children are described as serious changes in the way children typically learn, behave, or handle their emotions, causing distress and problems getting through the day. The rising number of students who have mental health concerns means that schools must prioritize time and resources when considering a student mental health program. NASN, again, the National Association of School Nurses, created a consensus document and a checklist on elevating the role of school nurses in school-based mental and behavioral health teams. School nurses are key members of the team and support student mental and behavioral health by providing direct care, including medication management, supporting emergency preparedness and crisis response, managing referral and care coordination, and conducting screenings to identify student needs. Some of the items on the checklist include educating school administration and school staff on your own education and training to support students with behavioral health challenges, collecting and sharing health data from your office, the school health office, such as the number of students visiting for stress, anxiety, and other behavioral health challenges, and then providing direct care to reduce stress and anxiety, such as mindfulness, and advocating for resources from state and local agencies. For more information, please check out the Elevating the Role of School Nurses on School Behavioral Healthcare Teams program through NASN, which was released in the fall. Next slide. Illinois emerged from the pandemic with a greater understanding of barriers that students and families have long experienced with respect to accessing high-quality mental health services in our state. Ask any school nurse and they'll tell you about their direct experiences working with families to remove some of these barriers. Many school districts have responded to these more visible barriers by investing in wellness and resilience initiatives. The overall health system is struggling to effectively address children's mental health due to limited resources, lack of access, high volume of patients in crisis, and limited support available for providers. Additional barriers include inadequate funding at the state and federal levels, lack of insurance or limited coverage for behavioral healthcare services, and a shortage of child behavioral healthcare providers, which leads to those long wait times for treatment and or families having to travel long distances for care, which we have all seen far too much in our schools. There's a new effort to strengthen children's mental health care in Illinois. So in November of 2022, the administration of Governor Pritzker announced the launching of a new state program designed to help pediatricians and other providers that meet children's mental health needs by strengthening mental health services in emergency departments and in schools. The new program focuses on increasing the volume of consultation services provided across the state, providing a multitude of mental health education and training opportunities to physicians and healthcare professionals, and then strengthening the network of mental health resources and referrals accessible to providers and to their patients, our students. It will also explore the feasibility of direct provider-patient telehealth service programs. And then a vision for improved behavioral health care for Illinois children was released last February. The Transformation Initiative builds upon the substantial progress made by Illinois agencies to ensure that every young person experiencing mental or behavioral health problems can access those needed services. By identifying and addressing current barriers to delivering efficient and effective care, the Transformation Initiative hopes to improve the state's ability to offer families a set of streamlined, accessible, and responsive solutions. The governor also empowered the Transformation Initiative to analyze systematic problems, and in collaboration with the 6 child-serving state agencies to develop creative, evidence-driven solutions in order to achieve the 5 goals. So it's important to note here that the Illinois Association of School Nurses, IASN, is also conducting a needs assessment on the state of school nursing. This is particularly important to identify the actual shortage of school nurses, with the overall goal being to advocate for every school to have access to a school nurse every day, no matter the zip code. The inaugural meeting of the Illinois Pediatric Mental Health Advisory Council with the Illinois chapter of American Academy of Pediatrics, Illinois Doc Assist partnering with UIC, ISB, and IDPH was actually just held last week, and the voice of school nurses was at the table. The goals of that council are to draw key stakeholders together to advise and support this project and give their expertise and experience in pediatric mental health. So more to come on that work. There are many initiatives and legislation in the works to help promote mental health and well-being in schools. Subject to appropriation, the Department of Healthcare and Family Services shall establish the Wellness Checks in Schools Collaborative for school districts that wish to implement wellness checks to identify students in grades 7 through 12 who are at risk of mental health conditions, including depression or other mental health issues. Illinois Doc Assist is another service for Illinois healthcare providers, including school nurses, for mental health consultation and for pediatric mental health concerns. It's a free service. And in an effort to provide an improved coordination in the delivery of mental health services to youth, Illinois developed the Screening, Assessment, and Support Services, we all know this as a SAS program, for children and adolescents experiencing a mental health crisis. That initiative has already been with us for the past 10 years as part of the implementation of the Children's Mental Health Act. The program features a single point of entry, the crisis and referral entry service, which we know as a CARES, for all children entering the system, and ensures that children receive crises services in the most appropriate setting. This is not an exhaustive list of services and programs available here in Illinois. I would encourage all school nurses joining us here today or watching the recording after to check with their local health department to see what resources are available right now for your students. Other resources include the Suicide and Crisis Lifeline 988, the Trevor Project, which is a national counseling program, and then NAMI Illinois also has a number of programming opportunities for those in need of their services. Before the start of the 2024-2025 school year, there are plenty of opportunities for school staff, including school nurses, to complete learning around the definitions of trauma responsiveness, and healing-centered care to meet requirements of a new Illinois law. The Center for Childhood Resilience through Lurie has a statewide trauma-informed school climate community of practice program that satisfies this requirement for school nurses. And I know Dr. Gill will be talking more about this and the resilience education to advance community healing, the Reach Out initiative, which is supported by the Illinois State Board of Education with funding from SAMHSA grant funds. Next slide. Multi-tiered systems of support. I apologize. I didn't put that on Do Not Disturb. Multi-tiered systems of support is a common framework used by school behavioral health team providers to assist students and match them to appropriate supports. The MTSS framework uses a public health approach to promote student well-being by identifying 3 tiers of prevention to support the needs of the entire school population. So tier 1 programs, those are often called, universal or primary prevention programs, typically implemented school-wide and meant to benefit the entire student body. Tier 2 programs are designed as targeted or secondary prevention programs. And then tier 3 programs are generally individualized and are often described as tertiary prevention programs. Another framework, the Positive Behavioral Interventions and Supports, PBIS, provides a similar tiered approach to organizing and delivering services. So regardless of the framework, many schools have launched a student mental health program, and research shows that these programs help students achieve academically and build social and leadership skills, self-awareness, and positive connections to adults, in their school. School nurses can build their team's capacity to deploy a multi-tiered system of supports that is responsive to the student's needs. The frequent office visits from children who often present with physical complaints such as an upset stomach could actually have that they can actually have an underlying mental health issue. We are the leaders for identifying these students that may be at risk for mental health problems and referring them to other members of our team here, including social workers and counselors. Next slide. The National Association of School Nurses and the American Academy of Pediatrics recommends that school districts provide a full-time school nurse in every school building. The benefits of school nurses reach well beyond the school walls. The framework for 21st century school nursing practice is aligned with the whole school, whole community, whole child model. School nurses apply practice components to address social, mental, and physical health concerns at the individual student and the population level. Given the early onset of emotional, mental health, and substance use disorders and their subsequent costs, investments in prevention and early intervention programs are necessary. Proactive school nursing practice encompasses the principles of community and public health nursing. School nurses, the services that we provide address access to care, cultural competency, health education, health equity, outreach, risk reduction, social determinants of health, and surveillance. The whole school, whole community, whole child WISC model focuses on the child to align the common goals of both public health and education sectors to put into action a whole child approach to education. The WISC model is student-centered and emphasizes the role of the community in supporting the school and the connections between health and academic achievement and the importance of evidence-based school policies and practices. The WISC model has 10 components that I encourage all participants to explore on their own, but I do want to highlight two. The first being, of course, health services, and then the second being counseling, psychological, and social services. The WISC model meets the need of greater emphasis on both the psychosocial and physical environment, as well as the increasing roles that community agencies and families play in improving childhood health behaviors and development. The WISC model also addresses the need to engage students as active participants in their learning and health. So the CDC really developed this model to strengthen a unified and collaborative approach designed to improve learning and health in our nation's schools. Again, we are the experts and often the only healthcare provider that sees that students see apart from their annual checkups. We have a responsibility to identify students at risk for mental health problems and referring them to either other members of our team here in school or outside providers. When discussing school-wide depression screenings, there are opportunities for schools to partner with organizations like Alyssa's Mission and Erica's Lighthouse to screen school-wide. For example, in my school, we screen all current 9th graders for depression in their PE class by partnering with one of these organizations. And it's important that we also have crisis protocols, that these be developed well before rolling out any kind of mental health, mass screening. Among the districts reporting that no current screening activities occurred, 80% reported a lack of qualified personnel as a barrier to universal screening. And that we're going to be talking about that with the legislation side of it. Next slide. In the consensus document mentioned previously, NASN highlights opportunities for state, regional, and community stakeholders to further embed school nurses into existing student support structures, amplify current efforts to address students' mental and behavioral health needs, and improve systems of care. NASN acknowledges that each school nurse and education system might have different levels of readiness or capacity to support mental and behavioral health. Nevertheless, adopting some or all of the following recommendations can increase system-wide capacity and create a more capable, integrated, holistic, and then just an interconnected system of care. So I encourage my colleagues joining this webinar to really lean on NASN to stay connected with the most up-to-date information for our students, our staff, and the community when it comes to not only this topic, but for all. I'll say it that we are the experts and often the only healthcare provider that a student sees, and we have a responsibility to really identify those students at risk for mental health problems. So it's important that we present the data to our direct supervisor, other administration, on what we're seeing here in our office. And if you don't have a tool already to collect the data, then please refer to the National School Health Data Set. Every student counts, and just data really does tell a story. And districts can take advantage of nurses' significant expertise by ensuring that school nurses have a key role in school-based mental health structures. As schools and districts develop and iterate their approaches to student mental health, it is important to include school nurse perspectives in planning processes and procedures to ensure their critical roles are incorporated clearly and consistently. Formally acknowledging the ways in which the school nurse already serves as a mental health care provider can strengthen mental health care delivery. Schools can continue to build their capacity to address mental health needs by connecting all school-based providers, including school nurses, to continue to build more integrated and aligned systems of care for students. I'll hand it over to Dr. Gill to discuss what Lurie's and the REACH program are doing and what she's spearheading over there. Thank you.
Thank you so much, Gloria, for all of the wisdom. And I think that our talks will definitely be aligned. So as was mentioned, I'm a psychologist at Lurie Children's Hospital. We are part of, at the Center for Childhood Resilience, we're part of a forward-facing department within Pritzker Child and Adolescent Behavioral Health. And so in these roles that I have, which have been already described in my bio, I had the opportunity to engage young people with the curriculum, the HEAL program that addresses mental health awareness, including identification and knowledge about mental health disorders, access to care, and other public health considerations, such as social influences of health, and increasing their knowledge and understanding of mental health career professions. And so from that, is where I kind of get my joy and my passion, and really talking with young people about mental health. We often provide mental health support, but don't always talk to them directly about that. So 2 questions that often come up really for them is, how do I get connected with the counselor? And they want to know a little bit more about mental health. So if you can go to the next slide. In your pre-readings and during the introduction, you heard some particularly challenging statistics that represent the complexities for our youth. You already may be aware there's increased mental health challenges in the last several years. There's been a rise in suicide rates. There has been a disproportionate negative impact on minoritized youth and those from disinvested communities. The alarming number has impacted acute care. It's impacted waiting lists and mental health challenges reported in the schools. We've known for quite a while that we cannot mental health our way out of this problem by only staying in our offices and treating people in a traditional format. So we will have to continue to strengthen clinical services in schools and acute care, while also thinking broadly about ongoing integration into medical practices, schools, and community spaces for youth. So just the question that I always want to know, like, what does this really look like? What does youth mental health support look like? So in the next slide, we know it's important to note that many of the initiatives and problems developed for youth and what we have accepted about youth mental health has been learned through adult-led inquiries. It is important to have youth involved in dialogue that is directly about their mental health needs. So no matter how much we try we do, we cannot replicate the perspectives of youth due to our generational gaps and more traditional approaches toward healthcare. We can start by communicating, normalizing, and helping. For example, in 2023, the Illinois Children's Mental Health Partnership convened a youth council consisting of youth and community partners throughout the state to provide recommendations about youth mental health. Some highlights of their recs included working with religious leaders to bring mental health into religious spaces. Particularly, they wanted to know, could we bring them into mosque, for example, and provide more scholarships to promote diversity in counseling mental health professional spaces, and encourage a loosening of regulations that allow for more mental health professionals to work under a provisional license while completing educational requirements. And this particular recommendation came from an African-American student who's studying counseling and really was feeling the weight of being a provider that he knows is not very common in the workplace, and that he cannot serve all the people who wanted to see him. They also talked about having additional educational supports, as well as providing opportunities for voice around issues related to LGBTQ youth. So I do think that it's important for us to, while youth are having these conversations, continue them in spaces where they're not kept in private, reducing the stigma, and providing help and support whenever possible to give them a mic and a voice to elevate some of their concerns. I also think it's important that we start to help to remove some of the barriers that are in their place. We can't rely on youth to remove their own barriers. And we have to be honest about what those barriers are. We can't just say, oh, well, I know if you have insurance, you can go to see the doctor, but then you don't tell them about the 6-month waiting list. Or you tell them, like, I know there's counselors in your school, but then you don't explain to them that there are limitations that you might encounter. So I think it's important for them not to feel defeated by speaking to them and giving them agency over their own situation. The next slide. It's important to educate and support youth in order for them to have the knowledge and skills to engage in their own empowerment and partner with others. The power to override cultural norms, stigmas, and stereotypes can be bolstered with some of the strategies. I'll just highlight a few. For example, instilling mental health into all the places where youth go. So they're in schools every day, Monday through Friday. There's after school programming, there's religious institutions, and that is really the example of meeting young people where they are. There's a lot of information in public domain spaces. Young people spend a lot of time online, a lot of time on the internet. And sometimes that information is not grounded in fact or science. So as mental health professionals, we need to be louder than those who do not have the proper credentials or that may even dismiss some of the science that we offer and discourage trust of the medical system. So historically, there have been reasons for certain groups and cultural backgrounds to be suspicious. It's important that we tackle these truths and recognize that we cannot outrun our early prejudices and practices, and must own the harm that has been rooted and passed on through generations. The adults who make up the village that support youth do not necessarily have to be mental health providers. And I know for some people that feels somewhat controversial. We want to think about addressing maladaptive coping strategies because they are abundant in our everyday circumstance, and do things proactively, like teaching young people about meditation and self-care and helping them to develop hobbies. And when we're doing that, they're less likely to adopt some of these lesser healthy practices that can worsen mental health and increase some of the at-risk youth. So lastly, and perhaps more importantly, recognizing that the biases, stereotypes, and stigma that youth have experienced may be layered in more than age-related fears or naivety about the system. They may have experienced the impact of racism in other aspects of their healthcare and are reluctant to trust the medical system, which even more personal information and acts them by surrendering their trauma, symptoms, and lived experience to the institution that they still have some concerns about trusting. And as much as I think that psychology is a really like welcome profession, I recognize that some of the practices are not intuitive to the culture that we want to bring into our services. So just recognizing that there are deeper challenges that we may have been tackling in our professions, and we need to be able to have those important conversations, and let's not like brush it aside and really start to explore some of the deeper rooted issues, which may require some instrumental and structural change. Next slide. So I won't belabor here. Gloria Barrera has already described the MTSS process that takes place in schools, but I will mention that for community and for youth, there are processes in which we look at things in a tiered circumstance. I'll simply say that when we're looking at public health and prevention, we know that we have to come up with better ways to bring the conversations about mental health and wellness into the public domain. We have to normalize and provide available resources to foster that education. Thank you. This healthy environment, this concept of trauma responsive environment, we work within that system a lot at the Center for Childhood Resilience. And one of the things that we teach educators is that it's important to build an environment that's going to respond to whatever comes into your pathway. We don't necessarily know who's walking into our doors and spaces that have been exposed to trauma, but we can do what we can to develop a healthy village of caring adults and develop healthy relationships. So what that might look like when you're in spaces with young people is knowing their name, calling them out their names, not out of their name, calling them out by using their name, recognizing safety is important, emotional and physical. And it's tricky because for some people, that means having security and metal detectors, which creates a sense of safety. But for other people, that's simply having adults from the community on the pathway as you go back and forth to school and really connecting with people in the neighborhood. Also, part of being a trauma responsive environment is teaching skills and regulation. So again, are you teaching some of the things that you learn in practice? I teach young people how to breathe, how to take those deep, relaxing, diaphragmatic breaths in order to bring calm into their lives. I always tell them it's free and no one can make you not breathe. And, you know, that kind of gets them because they love the idea of someone can stop them from doing something. And additionally, you want to infuse culture and equity and a trauma responsive environment and in the work that you're doing to bring folks over to the side of mental health so that we are not only saying stop the practices that you do in your culture and do the things that are grounded in what we do in mainstream or in healthcare, and being able to have a more balanced and nuanced way of addressing them. And then lastly, we want to make sure that self-care is at the forefront. Adults have to be able to take care of themselves, and then also to teach those skills, but you cannot do and teach what you don't model and already know for yourselves. So in the next slide, we do talk about what happens in schools. Again, that has been covered to some extent. And so I just want to highlight a couple of things, and that is the examples of school-based mental health. In Chicago Public Schools, where most of you all are probably most familiar, they have approximately 600 plus schools, and they have developed a framework called the behavioral health team model, in which multidisciplinary teams of people are trained in schools to come together, identify what are some of the challenges that a youth might be facing, and then be able to pair and match them to the service that's going to best meet their needs. So that does involve some identification, screening, sometimes interviewing, and then connecting the youth with what is the next best step for them, which may or may not include, like with therapy, it may actually include like connecting to after school or connecting to something that's in the community space. What you see pictured are some of the school-based interventions that are offered in schools that are evidence-based and are designed specifically for implementation in school services. Some of the programs, such as the CBITS program, can be offered in spaces like the hospital. And we are also running things like the Sparks program, which is another trauma intervention inside of the hospital as well. Okay, in the next slide, we have some important reminders and numbers. I put these up there just to make sure that we are aware, even though we know that we should always be equipped with these essential like mental health linkages. Most of the time, young people do not know where to start, particularly if a peer approaches them and says, hey, I need some help and support. So by the time that peer gets connected, they've told their story like 4 or 5 times. So really being able to connect them in an emergency circumstance to someone that's going to be helpful. Supportive adults are great, but when there's a crisis, they need to be able to like acknowledge and recognize what a crisis is. So we do talk to them about what's the difference between a crisis and something that maybe can wait until you get connected to service. You want to make sure that we are not saying one or the other, but you want to do a little bit of all of the things. So connecting them to people that they know in real life, but also perhaps giving them some other resources where they can tap into if that need arises. That's it. And just make sure that if you're giving them resources that you have vested that resource, and make sure that, you know, the numbers work and all of that is really important because they are trusting you. On the next slide, there's some more non-crisis services that are indicated. And so I just want you for a second to imagine that if you are a young person, you may have insurance, you may not. Sometimes young people don't know whether they have insurance, but they do know that they have some needs. And so just connecting them to people and encouraging them to continue help seeking throughout the entire process, because it's not just one step, there's a series of steps. You would be surprised how many of the young people that I encounter don't know the basics of, like, you can turn over your insurance card and there's a phone number and there's someone that can help you and answer some of the questions you might have about, can I pick the location? Can I pick the gender or race or specificity of a profession of my provider? And some of those answers are yes, but they don't have that basic information, and helping them to also bring in their parents or caregivers into the discussion so they can be more informed. Lastly, for resources, the Spider is a resource that was developed by Northwestern in partnership with the state, and it is like a database where you can go and gather additional resources. The Spider is being replaced by the Beacon, which on the next slide we'll speak a little bit about, and that with Governor Pritzker, recently there was a partnership with Google, and in that partnership, they are building what they call Beacon, which is a better way to connect youth with mental health and healthcare resources. There are also some initiatives that are going on throughout the state that are listed here, such as the Children's Behavioral Health Transformational Initiative. There are a couple bills that are pending. One is in the House, one's in the Senate. The one in the House is addressing social worker licensure so that those that are working, for example, in schools can remove the requirement to make it easier to provide services there, as well as working on the initiative of the Healing Center framework that's happening at the task force level led by Lieutenant Governor. And the next slide talks a little bit more about some advocacy efforts, and I'll end with the advocacy efforts. And a lot of times people say, if I'm not working directly with youth, but I want to have a role in helping them in mental health, what could I do? And advocacy to me is always something that everyone can do. So sometimes it is advocating for sustainable funding for children's mental health. Sometimes that's a funding that doesn't always get the attention that it deserves. You also want to elevate youth voice whenever possible and make sure that youth are getting placed in the right spaces to elevate their voice. If you have any governing bodies or structures, developing a board, a council, or a task force, consider adding youth to the table. And then the Illinois Children's Mental Health Partnership recently made some recommendations for the state about mental health, as I referenced earlier. So perhaps follow some of those recommendations and initiatives and see how they develop over time. So at this, I will turn back over to Dr. Allen for if there's any time for questions or close out next steps.
Gosh, I'm sorry. Thank you, Dr. Gill, and thank you again, Gloria. This was very informative and enlightening, and really important to hear how kids with mental health and substance use issues are identified in the schools, and then how they're helped in terms of getting treatment. I guess I know we have a few minutes, and I wanted to see if anybody has any questions. Feel free to put them in the chat. But I guess one question I have, and Dr. Gill, this might be for you, but all of the mental health support services you talked about, can you remind me, are those just for public schools, for example, in Chicago, or are they mandated or available across even private schools? You're on mute too.
Mute tag, you're it.
Yeah.
Okay. So essentially this model was co-developed with Lurie Children's and CPS. So it started within CPS and it's expanded and now is in, they're building out the expansion. We're expanding mental health services and supports throughout the state. So the building of the specific model of a behavioral health team may not exist in your school, but as I believe was mentioned, that the state is moving toward universal screenings and mental health assessments for students. So there's lots of initiatives that are complementary to one another that's going to get us to where we need to be so that screenings and identification can happen. And then just kind of essentially, I think, making some of the things that have happened in the last year more robust, such as making counselors in every school or adding more social workers as part of initiatives related to suicide prevention. So there's lots of opportunities that are building, but that specific model is just at the stage of expanding in our state.
Gotcha. Well, thank you. And you mentioned universal screening, and I'm curious about that. If we can just touch on that quickly. I think of the kid who has externalizing behavior, so acting out in the classroom, and it's pretty obvious, and people can offer that kid help. But then I think of the kid who has a lot of internalizing symptoms, depression, and it's not always obvious. And so I'm kind of thinking about those kids whose illness may not be obvious to people. What are your thoughts about universal screening? And don't want to put you all on the spot, but I'm just wondering, is that something that you think could be helpful across the board to identify
Mhm.
symptoms that may not be noticeable, or do you think you think that might be a waste of resources and it might be more appropriate to do this sort of when it's indicated or when there's a concern? Um,
So universal screening is happening now. So
okay,
I think in our state, so there's kind of like not really getting around that. But particularly with the behavioral health team model of being able to refer students by teacher referral, parent referral, student self-referral, as well as having some type of system where the data identifies a student and then brings them into the attention, you see less students are getting overlooked, particularly those internalizers. Often the students that get attention are those that are being suspended or disruptive to the classroom. But in a model where you're saying, you know what, this student's gone to the nurse 3 times in the last week, or this student has had some attendance challenges, let's take a look and see, are there social and emotional behavioral challenges that they need support with? That's a more robust way of looking at behavior problems instead of waiting just for the kid to act up in class.
gotcha. And
Mhm.
I'm sorry, one clarification question. Universal screening is all across all schools or just public?
There
The
was,
mandate.
oh, I'm sorry, you did ask about public. So I don't know, that's a great
Okay.
question, whether if you mandate something in a state for public funded schools, if that also applies to private schools. That's a
Okay.
great question. Perhaps Gloria may be more clued in on that.
No, I'm not, but yeah, that is a good question that we can follow up on.
Yeah, I'm sorry. I know it's new on the horizon, so it's probably something we're all learning. So thank you. Well, I don't see any other questions in the chat unless Deborah, are you seeing any? Well, I guess I'm sorry, there is one from Katie. What resources can private schools, especially small schools, tap into for screening?
Mhm.
I mentioned 2 organizations, and I'm not sure if they're strictly only working with public schools, but you can, for Katie, you can follow up with Erica's Lighthouse or Alyssa's Mission.
Also, the National School Mental Health, the National School Mental Health Council has a guide that came out in the last few years, and it has some templates or different screens that you can choose from. And there are a couple other, like on the national level, where they float around different screening tools. And so there's not necessarily only one way to screen or one tool to screen. Essentially, the mandate often gets into funding. From
Gotcha.
if you're looking about the private versus the public, is there someone to administer those types of screenings?
Gotcha. All right, thank you. And we have one question, and this will probably be our last, because I know, Deborah, you have a few announcements. The question is, are there any efforts to encourage schools to strengthen relationships with local SAS and community mental health providers to provide additional services to students? Any efforts to encourage schools to strengthen relationships with SAS and community mental health providers?
I'm not aware of any that are happening at a very structural level. I do know that when we work with consultation and coaching with schools, we do talk with them about making sure that because SAS is an organization, but they're also divvied into community partners that are often local. So having them to develop localized relationships with their SAS workers. And if you have a behavioral health team in your school, it's likely going to be some of those same people on that team that continually interact with them. So there have been instances in the past where those folks have been invited into the schools for partnering and further to develop that relationship. But I don't know of any initiatives in which they are at a structural level really trying to facilitate greater bonds between schools and those SAS workers.
Gotcha. All right, well, thank you guys. I know we have to end in a minute. I'll just turn this over. Thank you again, Dr. Gill. Thank you, Gloria. Turn this over to Deborah for some closing remarks.
Okay, thank you, everyone. Very informative. It's very important topic in so many ways that you touched upon today and gave a lot of resources. So I just want to share with everyone that if you'd like a copy of the PowerPoint, we can provide that to you. This is videotaped. It will be on YouTube in a couple of days next week, so you can view it again and also pick up a lot more other details as well. If you are interested in becoming a fellow of IOMC, please go to our website, www.iomc.org. And there's information on our programs, our upcoming meetings, and of how to become a fellow of IOMC. You can be nominated by someone who's currently a fellow of IOMC, or you can self-nominate and provide a few references so that your credentials can be checked accordingly. So we, again, it's an interdisciplinary organization. We have academics, MDs, PhDs, nurses, social workers, pharmacists, legislators, and so on who are part of the group, and we'd welcome your participation. So on behalf of IOMC, thank you so much for attending today. And we hope that you will join another program in the future. And if possible, attend the June 20th annual meeting and healthcare awards, and consider nominating a colleague or a worker or your organization for one of the awards. There's no fee to enter for the healthcare awards, and you also do not need to be a fellow. So therefore, there's no barrier for you to participate and join us, in the coming months. We do have a LinkedIn page on, so please look at that and consider being a follower on LinkedIn. There are numerous blog posts that are also posted and that about information such as what we shared with you today, and other articles as well. So have a wonderful weekend. And lastly, thank you again to the speakers. Truly a magnificent presentation, a lot of good information, and very important overall. So have a good weekend, everyone. Take care.
Thank you.
Thank you.
Thank you.
Bye.